7. Early warning signs of colorectal cancer. Hello, dear listeners. I'm Dr. Nguyen Min, a specialist in gastrointestinal diseases and colorectal cancers with over 20 years of clinical experience. In today's episode, I'd like to share something vitally important: the 7 early warning signs of colorectal cancer, a silent yet dangerous condition that can often be detected early if we learn to listen to our bodies. Why should we be concerned? According to the World Health Organization, WHO, colorectal cancer is the third most common cancer worldwide, claiming the lives of around 700,000 people every year, making up over 8% of all cancer-related deaths. In Vietnam, approximately 8,000 new cases are diagnosed each year, and unfortunately, the number continues to rise. Most patients are diagnosed at a late stage when treatment becomes more complex and less effective. But here's the key: colorectal cancer often shows early symptoms. The problem is, we tend to ignore them. So what should we watch for? Here are 7 warning signs you shouldn't overlook. 1. Loss of appetite, bloating, poor digestion. You might feel your stomach is constantly full or distended, especially above the belly button. You eat less, feel bloated quickly, or just can't digest food properly. Over time, this can lead to unintentional weight loss. 2. Recurring abdominal cramps or spasms. These aren't sharp, sudden pains, but rather persistent, crampy discomfort. They may come in waves, similar to intestinal spasms, often mistaken for stomach issues. But if the discomfort tends to settle lower in the abdomen and repeats, it's time to pay attention. 3. Chronic constipation or altered bowel habits. A sudden change in your bowel pattern, persistent constipation, or alternating between diarrhea and constipation could signal that something inside your colon is blocking the passage of stool, possibly a growing tumor. 4. Thin, pencil-shaped stools. If your stool appears narrower than usual, it may be due to partial obstruction in the colon, often caused by a mass or large polyp compressing the intestinal walls. 5. Rectal bleeding or blood in the stool. This is one of the most common early signs of rectal cancer. You may notice bright red blood on the surface of the stool, or dark, tarry stools if the bleeding is from higher up. Often misattributed to hemorrhoids, but if this keeps happening, especially with bowel changes, don't delay a medical check. A 2020 study in the Journal of the American Medical Association, JAMA, found that 46% of colorectal cancer patients had rectal bleeding in the early stages. 6. Feeling like you haven't fully emptied your bowels. You may feel an ongoing urge to defecate, but nothing comes out. This can be a result of a tumor partially blocking the rectum, creating a false sense of needing to go. In medicine, we call this tenesmus. 7. Fatigue, dizziness, and pale skin. This is usually caused by chronic blood loss from the digestive tract, leading to iron deficiency anemia. Many dismiss this as general tiredness or poor sleep, but if you're unusually tired despite a good lifestyle, a blood test could uncover something serious. Who's at risk? Colorectal cancer is strongly linked to lifestyle, age, and family history. Your risk increases if you're over 45 years old, you have a family history of colorectal polyps or cancer, your diet is high in red meat and low in fiber, you've had long-standing inflammatory bowel disease, you've used antibiotics long-term which may disrupt gut bacteria. How to protect yourself? Eat more vegetables, fiber-rich foods and fruits. Reduce intake of red meats and fried foods. Stay hydrated and avoid constipation. Exercise regularly. Get routine checkups, especially if you have a family history of gastrointestinal cancer. Colonoscopy is recommended every 3 to 5 years after age 45, or earlier if you're high risk. Final message from Dr. Nguyen Min. Don't wait for serious symptoms to take action. A single colonoscopy or blood test could help catch cancer while it's still just a tiny polyp. And when detected early, the cure rate can be over 90%. Thank you for joining today's episode. If you found this helpful, please share it with your loved ones, especially your parents and older family members. I'll be back in future episodes to bring you more clear, accurate, and easy to understand insights on digestive health. Take care and see you next time.